There's been a very serious increase in whooping cough cases in Quebec over the past few weeks, enough for major concern. So as always, when we have these types of issues, very happy to be joined by Dr. Christopher Labos, an epidemiologist with a degree in cardiology. Dr. Labos, as always, thank you for your time.
Oh, my pleasure.
So first of all, I think most people are aware of what whooping cough is, but maybe not how serious it is with children. So maybe give us a primer, refresher on whooping cough.
Right. So, I mean, it is a bacterial infection like many other bacterial infections. The reason why we call it whooping cough, its official name is pertussis, by the way, but it's called whooping cough because the people who get sick because where the bacteria causes inflammation in the throat, the people who are coughing have this sort of stereotypical whooping cough. It really does sound like them going whoop, whoop, whoop. Hard for me to recreate, but
Sure.
It can be a very serious infection, especially in the very young and the very old, and especially with very young babies because they are more susceptible. If they have an inflammation in their throat will close up. They will have to be intubated, and that's the real harm of it. While, if you're adult, you will get sick, but you will eventually recover, especially now that we have antibiotics. But a young baby may end up in the neonatal ICU, and that's a serious infection for them.
I'm reading here over 900 cases reported since the start of 2024 in Quebec. So how concerning is that? What would be a normal year up to now?
Oh, it would be a fraction of that. And this is a phenomenon we've been seeing across the globe. I mean, the real increase, the preview of what we're seeing now has been happening in the UK for a couple of months, where they've had more cases, 3 times more cases in 2024 than they had all of last year during a typical year. So we're seeing a global increase in whooping cough. And that can almost entirely be attributed to the fact that vaccination rates have been flagging in recent years. I mean, this is a preventable disease. When you have high vaccination rates, you don't see very much of it. But when vaccination rate starts to fall, it has an increase. And this is what we've been seeing, throughout Europe actually for a while now. And that has now started to translate to us as well.
So, for us totally fake experts on pandemics, but does this mean that, it's about because the vaccination rates have been going down, we haven't achieved herd immunity? Is that the issue here?
Well, sort of. What herd immunity means is that because there's always a small number of people who can't get vaccinated. So what herd immunity means is that if you have enough vaccinated, immunized people in a population, they will protect the unvaccinated, the non-immune, because there isn't enough circulating virus out there for them to get infected. So what you're suggesting is sort of correct. But what we're seeing now is just that, if you have more unvaccinated people out there, you just have more opportunities for the bacteria to infect people. And that makes it easier for it to spread because it just has more hosts that it can potentially affect. So we're sort of seeing essentially the flip side of herd immunity, which is you have more unvaccinated people, more infections. And if you have more infections, just proportionally, you'll have more children getting severely sick and ending up in hospital.
Okay, so for parents and grandparents out there, what should we be on the lookout for with children? What are the symptoms and what should we do?
It really is the stereotypical cough. That's sort of the sine qua non. I mean, if you've ever heard it before, you will never forget it because It really does sound like that whooping cough. But this is, a upper respiratory tract infection. Like every other, it's just more severe. So if you have a child that's seriously sick and not getting better and in fact getting worse, get to hospital because this is something that can, progress very, very quickly. And it is treatable with antibiotics and, with supportive care that we have in hospital. But the best way to prevent it is to not get sick in the first place. And the way you don't get sick in the first place is to get vaccinated against whooping cough.
So this is obviously not the first time I or other CJAD 800 hosts have asked you this question, but here you go, Dr. Labos. Talk to these parents. What's the argument to get your kid vaccinated if that hasn't been done yet?
hasn't been done yet is that they could get infected in the future. I mean, you might say, well, I'll be fine. My child will recover. You don't actually know that. And in the UK, I think in the most recent report, like five babies died of this. So this is not a trivial thing. And, you might say, oh, my child will be okay. I mean, we do have a nature such that we always think that bad things happen to other people. But bad things can sometimes happen to us as well. And if people get vaccinated, we don't see very much whooping cough. In fact, the vaccine was introduced, whooping cough rates dropped off some 89%. It's some huge number. If we don't get vaccinated, it comes back. And when bacteria and viruses surge the population, more people die as a result. It's just the simple mathematics of it.
Appreciate your insights as always, Dr. Labos. Thank you so much.
My pleasure. Take care.
Take care. Dr. Chris Labos, epidemiologist with a degree in cardiology. Always great information. Please, if you haven't gotten your kids vaccinated yet, please do so as soon as possible.